Hey, welcome to Wednesday, Dr. Nancy Live at lunch. We had a little hiatus the last couple weeks. Hopefully everybody got to watch Deb Furman's recorded live, but today we're actually live. And I'm so excited to introduce you to Bethany today. She is bringing midwifery to its Carmel St. Vincent Hospital, which is great. So those that can't do a home birth, we now have an option up here in Carmel. So I'm going to introduce Bethany Monte to you and let her tell us a little bit about herself. Hi, Bethany.
Hi, thank you so much for having me, Dr. Nancy.
Oh, my pleasure.
So basically, just to let you know a little bit about me, so I'm a Hoosier. I'm from Plainfield, grew up in Plainfield, and I kind of fell off the face of the earth a little bit, went all the way out to California for about 11 years, and then came back almost 2 years ago. And so I am now working at St. Vincent's Carmel at a clinic or a practice named Women's Health Alliance. So it is a St. Vincent's Medical Group practice. I work with 6 female physicians that support midwifery services here at St. Vincent's Carmel. So that's where I see patients in the clinic and then deliver babies over in the hospital. So the goal for the practice is to be able to offer midwifery services to women that really want that kind of care, trying to bridge the gap between home and hospital and make this a home-like experience, but just with the hospital support in case of emergency. And then also, you know, we bill insurance, so you don't have to worry about the finances. And I have the physicians are on call 24/7. So if anything became medically abnormal and we needed intervention, say like a vacuum, or say if you got really sick, or if you needed a C-section, then the physicians are always there. Otherwise, if everything is nice and normal, then you just stay under my care. And I talk with the physicians early and often if I see anything that might be of little concern. So I practice pretty conservatively in that manner because I want to make sure that everything goes really well for you in labor.
So how would you describe like a OB delivery versus the midwifery delivery? What's the difference between the two, or the similarities? Yeah.
Right. So basically the similarities are that I am trained as a nurse, and then I have a master's degree as well in midwifery. So I know all the medical risks, benefits, I know what to look out for, and I know how to make your birth be safe. So that's how we're similar. How we're a little bit different is that as a midwife, I really try and be there to help guide your labor and help you know how to keep the labor going, good positions to get into, how to stay hydrated and how to eat, and then also make it to where you're more able to move. And I give you suggestions. So I won't always be with you the 100% in labor, because labors can be a long time. So, and you do have the labor and delivery nurses who are very skilled in supporting your labor, but I will be in frequently to help make sure that the labor is progressing. And then when we start getting near time for pushing, I like to be with you most of the pushing time, so then I make sure that we have success, that you're feeling like you know what you're doing, and help just make sure that we progress towards having a baby. When you deliver, I don't make you be in one certain position over another. I like to allow women to have autonomy in how they feel in labor and what works best for them. And so that's a little bit different from an MD, because they're not as used to allowing women to have those choices, and they also are in a rush. So they have surgeries that are scheduled, they have patients that are scheduled back to back in the office, and so they're in a hurry and they need birth to be more easily moved along, and so I don't do that. So it gives me more flexibility to follow the labor and let labor be normal and not be rushed.
Well, that's wonderful. And how's everybody doing? We have a question here. Are you allowed to snack and drink fluids during labor then with you?
Yeah. So I always tell women, first of all, your labor will be far more successful if you stay home longer. So the moment you walk into an institution, there's more interventions, or your labor can kind of stall out because you're nervous. And so I always tell women the value is stay at home as long as you can. And we go over distinctly when it's the right time to come in, so you feel comfortable. So you're not going to deliver your baby at home without help. And then also, I usually have my patients call me when they go into labor, and I talk with them. And then I kind of gauge how they're doing, and should they come in now or should they wait? And a part of that is talking about, should you eat, should you not? And when you come into the hospital, I allow my patients to eat and drink until they are nauseous. And then when they get to the nausea point, I tell them not to, because it won't be very helpful. So here in the hospital, I believe if you're being induced or if you have an epidural, then you're not allowed to, just because those are medical interventions that you don't want to have food in your stomach for in case there was a need for a C-section.
Right. So also, in addition to delivering babies there, are you doing well visits and things like that?
Yeah, thank you so much for asking, because it is a misnomer for a lot of people that midwives only deliver babies and only deliver in your house. So basically, I do all women care. Love to take care of pregnant women and help their pregnancy be nice and healthy, and support them in answering all their questions. But then I follow you postpartum and make sure that mental health is well supported, help with breastfeeding, and then I like to do all your GYN care. So everything that you need as a woman, I can take care of. And then if it becomes out of the realm of what I can do, or if I think you need to see a specialist, I can do all those referrals. So I practice very much like an OB-GYN. I don't do surgeries. And I don't do other procedures that are maybe more medical, but I know the right people for you to go to. And the nice thing at Women's Health Alliance is that I have 6 physicians that I work with and I trust. And if I feel like you need to see one of them, I usually gauge how I know you and which physician you're probably going to best fit with. And I think that's better than just dialing someone up in the phone book. You have a practitioner that knows you and knows who you fit well with. And so I think that speaks volumes. Same thing goes in pregnancy. If anything becomes really high risk, you do not have to leave the practice. You can just transition over. And even before transitioning over, I try and do what's called co-management. So the physician and I would see you together and take care of you. And then if you became too high risk, you can just see that physician and you stay, it's seamless. You stay in the practice.
I was almost 40 when I had my daughter. And so I was like, I need to go to the hospital. I would love to have had a home birth because it fits with my lifestyle. But, I was old and I was like, I'm going to have a heart attack. So I'll never be in the hospital. But after I delivered, go ahead. After I delivered, I never saw the OB again. Maybe once, and that was it. So the continuing care, that's a great feature for having you there. Yeah.
Yeah. And just so you know, I've taken care of a woman. She did IVF, donor egg, donor sperm at 49, and she did beautifully. So, and she didn't have a heart attack. I really love doing whole women care and offering that. And then also I am learning more about doing integrative or functional medicine for women. And I think that's a big need in our community. And I don't like over-medicating women. I really want to get to the heart of the reason that they're feeling the way they are. And so I'm on a journey of offering that to my patients as well. And I've had a really great response to that. So I'm excited to be able to do that and offer patients who have insurance and need to see someone and bill insurance as something to offer to the community.
Yeah, that's so needed because everybody that's doing that is booked up. So thank you for putting that on. And the fact that you are going to accept insurance, that's key too. That's, oh my gosh, that's wonderful.
Yeah, good. I'm glad you're excited.
I'm very excited. Now, when I met you initially, you showed me a thyroid book. So is that kind of one of your specialties?
Yeah, so I'm actually specializing in that, and then also gut health for women. So there is a physician that I find to be just very refreshing. Her name is Dr. Aviva Ram, and she offers a certification class that's a year-long class. And I'm doing that currently. And she practices functional medicine for women. And she's really in it to help women feel better. She's not in it to make money. And I plan on doing the same. I don't want to overbill or make money off of supplements. I want to just make sure that women have good representation and good care. So a lot of that can be thyroid problems, gut health, and fatigue, chronic pain. So I'm feeling pretty good about it. I'm excited to be able to offer it. And I've had quite a few patients that have even just read Dr. Aviva Ram's book that they've, at 54, have lost 20 pounds and feel great. Wow. So yeah, it's been wonderful. And she didn't have to change much. So that book, in case you guys would like to read it, is called The Adrenal Thyroid Revolution. And it's by Dr. Aviva Ram, and that's R-O-M-M. She's really great. So yeah, I love learning from her.
Wonderful. I notice our internet's a little choppy today.
Sorry.
Are you seeing that on your end?
A little bit.
Oh, no, that's okay. It's both of us. So does anybody watching have any questions before we leave today? We'll give them a few minutes to type something in if anybody has questions, but we'll definitely have you come back on in the future, maybe to talk about the thyroid and things like that. You know, it's a very common issue with a lot of women, especially when they get into that age, when they have 15-year-olds at 40 or 40.
Yeah, there you go. I'm in there, so living the dream.
Well, Bethany, is there any last tips or anything that I didn't ask you that you'd want to share with our audience today before we leave?
Yeah, sure. So I think it's really important that women and families know that midwifery is not a new thing here in Indiana. We've had midwives all over Indiana, and we have a great midwifery practice that's actually in a hospital system that's downtown at Methodist. And they're the Health Net midwives, and they're fantastic. I just am trying to offer it here on the north side so that women don't have to go all the way down there. And then also I have patients that are driving from Kokomo, Anderson, that want this kind of care. So I'm excited to be able to offer it to the whole north side as much as people want to drive. Another thing that is good to know is that as a patient of a midwife, you are not relegated to going without medicine for your birth. If you want an epidural, if you want medicine, that is okay. I just specialize in using that as, say, an epidural or medicine as a tool to help your labor keep progressing so that we get that beautiful vaginal birth that's nice and healthy and safe. So if you need the epidural, that's okay. And that can help us tremendously at times as a tool. So don't be fooled by the whole midwifery thing. You can definitely have pain relief if you need that.
So you can have birth the way you want, pretty much, is what you're saying. Yeah.
Yes, because birth is definitely a choice. There are lots of choices that you have. And so you are autonomous, and I respect your choice. And that's what midwifery is really all about, is coming alongside women and hearing their voices and, helping them get what they want.
Great. Well, thank you so much for coming. I really appreciate it. Great information. And hopefully people will see this and come see you at Women's Health Alliance, Carmel St. Vincent.
Yeah. Can I give you the phone number, how they can get a hold of me?
Yeah. Let me type that in real quick here.
So it's 317.
Go for it.
582-9500. And I do have a Facebook page that I'm working on called My Midwife for Life, that people are welcome to find me there too.